Hello, student. Today's topic is about inflammation. So, first of all, we see what is inflammation. Basically, inflammation is a part of body defense mechanism. Okay, it is a part of body defense mechanism in which immune system recognize and remove harmful and foreign stimuli and begins the process begins healing process. Okay, it is also characterized by pain, heat, swelling, redness in the affected area, often referred to as rubor, calor, tumor, dolor, and function lesia. Okay, so there are two types of inflammation, which is acute inflammation and the chronic inflammation. And the causes of acute inflammation is happen basically acute inflammation happens when a physical factor triggers an immune reaction. Inflammation does not necessarily mean that there is an infection, but an infection can cause inflammation. Okay, acute inflammation can result from exposure to a substance such as bee sting or dust, and injury and infection, chemical irritants, allergic reactions, burns, trauma, and etc. And the chronic inflammation can develop if a person has sensitivity, like inflammation happens when in the sensitivity inflammation happens when the body senses something that should not be there. Hypersensitivity to an external trigger can result in an allergy. Second cause is also exposure, like sometimes long term low level exposure to an irritant such as an industrial chemical and etc. can result in chronic inflammation. Third cause is autoimmune disorders, like the immune system mistakenly attacks normal healthy tissue as a cirrhosis. Fourth cause is autoinflammatory diseases in which a genetic factor affects the way the immune system works, as in different diseases. And the last cause, if we talk about persistent acute inflammation, in which in some cases a person may not fully recover from acute inflammation, sometimes this can lead to chronic inflammation. Here are the symptoms of acute inflammation, in which there is a flushed skin at the site of the injury, pain or tenderness, swelling, and heat. Now, the symptoms of chronic inflammation, in which there is abdominal pain, fatigue or insomnia, joint pain or stiffness, chest pain, skin rash, fever, mouth sores, gastrointestinal complications like diarrhea or constipation, weight gain or weight loss, frequent infection, acid reflux, depression, anxiety, and other mood disorders.